digital monitors are definitely the way forward. And this is an example of one. This is an Omron digital monitor. There are a lot of digital monitors available all over India. The most important thing is any digital monitor you buy, always get it validated or calibrated in a hospital. Check your pressures with this machine as well as the pressure in the hospital machine. See the difference in about 2 to 3 patients also, and then because there will be a fluctuation about 5 to 10 mm will always definitely be there. So always get it calibrated before you take it home. And then whenever you check your BP at home, the best place and the best thing is the person should be comfortable and should be the best thing will be sit in your dining table, because you have a table, you have a chair, you have a backrest like this. So you are comfortable and you seated well. Before you check your pressures, a certain precautions have to be taken. So what are those precautions? The most important thing is do not have any food, any snacks or any meals for at least 1 hour before you check your pressures, because this will affect your BP readings. Along with that, avoid caffeine, tea, coffee, avoid alcohol, avoid smoking for at least 30 minutes to 1 hour before you check your pressures. Avoid any kind of exercise before this, because this will again alter your pressures. If possible, have an empty bladder and empty your bowels before the procedure. And then when you come, you have to be seated in a comfortable chair, most likely in your dining table, which comfortable chair. Uncross your legs. Do not cross your legs, because that again will cause fluctuations in your pressures. Uncross your legs. Keep your feet firmly on the ground and sit comfortably. Sit in this position for at least for about 5 minutes and you're relaxed. And then extend, keep your arm on the table, extend it, be relaxed. If you have a cloth, if you're wearing a full sleeve shirt, you can try to lift it up. But in case when you're lifting it up, you get wrinkles in this area, avoid it, because wrinkles again will cause your pressures to have a false reading. Coming to the machine, so this is the BP arm cuff. So the most important thing in an arm cuff is there are various sizes. So there can be a pediatric age group, a smaller size, or there can be very large age group. So how do we know which size the cuff is the best? So I think we can see here, there is a black line here which says there is a range. So it says a minimum as well as a maximum. So when you're tying this cuff, if it goes above this, across this minimum area, that means the cuff is very small. In case when you tie, it comes below here, that means it is very big. So I will show it to you, I will demonstrate, and along with this, so this is one line which you have to always check. Along with that, there is another point which once I put it, I will let you know. This arm cuff should at least cover 2/3 of the arm. It should be in the center of the arm, and from your elbow joint, at least about an inch above, you can tie it. There is something called there is an arrow mark which is here. So this is the arrow mark for the artery side. So this comes towards the center of the elbow. So once you are done, you fix this. Once you fix this, check if one finger space is there. If it is one finger space, that means you have fixed it correctly. Suppose you have 2 finger space and all that means it is loose, you have to tighten it more. So this is the correct method. The patient relaxed position, you have the arrow mark which is facing to the artery. The arm cuff is 2/3 of your arm, and this is the way. Then you switch on the instrument and then wait for the pressure readings to come. So we have 2 readings in this, a systolic as well as a diastolic reading. Most of the BP monitors also have a pulse recording also. So this is the way we can check your blood pressure with a digital monitor at home.
Is one recording enough?
So whenever we do a recording, especially a digital recording, we always tell, check the pressure once, wait for about 5 minutes, check your pressure again. In case the variation is about 5 mm between the first and second reading, it is okay. But if there is a severe, there is a strong variation more than 10 mm, that means you have to check it again. So always better take 3 recordings and take an average of that, or best possible take the second reading. So that will be always better. And also with this, When do we tell patients to check the pressures? How often do we check the pressures? That is also one thing the patients always keep asking. So this is one of the readings, 99/67, which falls in the normal range.
So in a normal adult,
Thank you.
how often do they check blood pressure? In a year, for example, or should everybody be checking their blood pressure, on a daily basis or something?
So in patients or in people who are less than 40 years with no comorbidities, no strong family history, active lifestyle and all that, once in a year, once in 2 years, they can check their pressures. But in a person who has been diagnosed to have hypertension, who says, okay, the BP is quite high, they have been started on medications or at least lifestyle modifications and all that, at least once in 3 months, 1 to 6 months, we can check. If they are elderly, not above 80 years and all that, with no other problems and all that, once a year also is okay.
So I generally follow this rule that anybody who is above 18 must check their blood pressure at least once a year. Above 40 or anyone who is a diabetic probably should check blood pressure once in 6 months. In case a patient has been diagnosed to be a hypertensive and the patient is on medication, they simply follow their doctor's advice, because sometimes the doctors want them to have more often, more frequent monitoring, or sometimes if the blood pressure is well controlled, the frequency may be dropped. So I think once a hypertensive has gone to a doctor and the doctors have advised, it is best to follow the doctor's orders. Otherwise, if you are not a hypertensive, above 40 or a diabetic, every 6 months once, and above 18 and not a diabetic, maybe once a year. I think blood pressure is a very common problem, and to diagnose early, to treat well, will prevent a lot of complications.
Okay. So along with that, so let's get down to numbers. When we talk about hypertension, people, and especially when now people are at home, they're checking their pressures many times, 2-3 times in a day, and they're worried, okay, it is not 120/80. I think all of us have learned it in school also, 120/80 is the normal pressure. So what, according to you and according to the guidelines, is considered as a normal blood pressure reading?
This is a very controversial, I won't say controversial topic, a confusing topic. Because every few years, some new international society will say that this is the normal blood pressure and this is hypertension. So I think a lot of confusion has gone around. And even today, if you look at Indian Society of Hypertension or European Society of Cardiology or American Heart Association, all of them will recommend different levels of blood pressure as normal and different levels of blood pressure as hypertension. I think without confusing ourselves, we can say, looking across, that normal blood pressure is 120/80 and hypertension, we can safely say, is 140/90 and above. So in between 120 and 80 and 140 and 90, it is slightly higher blood pressure or pre-hypertension or borderline blood pressure, or whatever one wants to call. Different societies have given different nomenclature, but those are the patients who have to be a little more careful. But I think treatment, whether it is in the form of drugs or more intensive lifestyle monitoring management, has to probably start once it is 140/90. And also, a single reading will never label a person as a hypertensive. There has to be revalidation. So today, if somebody has a blood pressure of 140/90, probably within the next 1 to 2 months, few more readings have to be taken and we have to confirm that it is high. Supposing somebody's blood pressure is very high, 160/100 or 170/100, then we probably should not be waiting for 2 months. We should be getting it validated within the next 1 or 2 weeks, and to make sure that the blood pressure is not high, or if it is indeed high, an early treatment probably has to be started. So blood pressure above 140/90 we can consider as hypertension. If consistently high BP is found, then treatment will become important.